90-90 hip external rotation. We're going to be using the intention of this exercise in order to increase the range of movement at the capsular level of the hip. This particular base position enables us to focus specifically on external rotation of that hip capsule. The setup starts with 90 degrees at the front and 90 degrees at the back. Some people may differ, and if it is uncomfortable on the back leg, you can pull in or adjust, or you may need to lean away or rotate. Like we said, the intention is to find the capsule of this front leg at the back of the hip. Sometimes it's going to feel quite superficial into the back of that tissue in and around the glute, but going through the next list will help you better target the tissues you want. First is a posterior pelvic tilt, so to tip the pelvis backwards, to bring the belly button forwards, and then to think about scooting the bum in this direction. Tilt, pull forward, tilt. Push back. If that still doesn't find the stretch for you, you can then start to lean forward, doing all those three previous things on the list. Once you find the stretch, we'll go into nasal breathing. And once you've done that for a little bit of time, 2 minutes or so, then we're thinking about pails and rails. Because this is a rotational exercise, your first port of call is to do the pails. So the things on stretch, from the passive stretch, we now want to load those. And we're going to do that by taking a big breath in and then driving our foot down into the floor. Okay? The knee is going to feel light, even though it stays down. And the direction is for the femur to come inside. Okay? In this direction. After you've done pails, we would then immediately switch to a rails contraction, which is the opposite. So the shin stays on the floor, the knee is driving down, and you're imagining that you're trying to pick the foot and the shin up off the floor. This way the femur is traveling to the outside towards the hand on the outside. We keep pulling, build up to the right intensity. 2, 1, slowly relax, get back into your breathing and see if there's any more passive room. You would then stay there for 30 to 60 seconds and then rinse, repeat.